Hello, this is Dr. Gay from First Second MRI, and this is a 62-year-old male who complains of a growing mass at the base of his thumb for about a year. He finally went into his doctor's office and they did an x-ray that shows no abnormality. This is his thumb, and the soft tissue area is right in this region, and we just don't see anything on x-ray. There are no bone erosions, no scalloping. The bones look normal. Sometimes tumors can grow and erode bone, but this patient does not have any evidence of that. So they did an MRI next to look at this. And on this view, that's called a sagittal view. We have the same view over here on the right side and left side. On this view, fat is bright, so fatty marrow is bright. We see the distal phalanx of the thumb. This is the tip of the thumb. The thumbnail would be over in this area. This is the pulp or soft part of the thumb over here. And we have the distal phalanx, proximal phalanx. This is the first metacarpal bone of the thumb. And we see a little line here. This is looks like a little cable. This is the extensor pollicis tendon. So if you hitchhike, this is the cable that pulls the thumb outwards, pulls the thumb up. And this is the other side. This is called the flexor pollicis tendon. This pulls the thumb downward to grasp things. And we see a round area here. This is a skin marker that's over the palpable abnormality. And deep to that, we see this lobulated gray thing, intermediate signal, a couple little foci of low signal, but pretty much it's intermediate in signal, very similar to the muscle. These are the thenar muscles in the base of the thumb here, and this looks very similar to muscle. Here's the lobulated soft tissue tumor, and this is the muscle looking really similar, hard to tell them apart. Now this is a view where fat is suppressed, so fluid, there's a little bit of fluid in the joint, stands out as white. This is the interphalangeal joint of the thumb. We see that extensor tendon again, the flexor tendon again, a little bit of fluid in the joint. We see the marker that's been placed over the tumor, and this is the tumor here. So it's relatively homogeneous, a little bit of mixed signal here, but sharply defined margins and very lobulated. And we note that it does touch the flexor pollicis tendon. This is the tendon, and this is the tumor. This is the muscle, very homogeneous compared to this tumor that's a little heterogeneous. So this is a fairly common tumor of the fingers, digits. This is called a giant cell tumor of the tendon sheath. Usually it's over a tendon like this, associated with the tendon sheath, and it's a benign soft tissue tumor. It's firm, and these can grow over time, and usually they'll see the orthopedic surgeon and they will resect them. This is another view, and after they resect these tumors, sometimes they can grow if there's a little piece left behind, so they have to be really careful to remove all of the tendon, the tendon sheath that is touching, and the whole tumor, so it does not recur. So this is again an example of a giant cell tumor of the tendon sheath in the 62-year-old male, and here it is on this view right here, looking very similar to the muscle, intermediate in signal, and this is that lobulated tumor, little septations or fibrous material interspersed. Thank you very much.